Dr. Patty here, physical therapist, lymphedema, and cancer rehab specialist. Today, we're going to discuss self-manual lymph drainage for the upper quarter. Please consult with your providers and your cancer rehab therapist if there's any questions or to make sure you perform this correctly. We're first going to start with our hands. I want you to practice with making some nice gentle strokes. What I do is I use right here my knuckles and just gentle stretch. So I go cross and direction, cross and direction. And it feels kind of like a C shape. So you're going to go up and down. Wonderful. All right. So we're going to start with our hands on our stomach. Take a deep breath in. Deep breath in. You want to have your stomach expand. I even give a little push just to get a little more breath work. Wonderful. Now I'm going to put my knuckles on either side of my neck, right along the side muscle. We're going to go back and down, back and down. We're going to do this 5 times. Okay, now this is my involved extremity. So I've had any lymph nodes taken out, any surgery, any radiation to this area. I'm going to try to send the fluid to this side. I also have a secret road that goes down from my armpit to my groin. So what I'm first going to do is I'm going to open up these secret roads so that I can go to the other side and then straight down. So we're going to open, and again I'm making a nice kind of C shape. 3, 4, 5, 6, 7, 8, 9, 10. Stretching the skin. Now I'm going to go to the unaffected side and I'm going to make 5 stretch and directions toward the healthy lymph nodes. Wonderful. Now we're going to go ahead and go right here. I'm going to press down, and you're just going to give like 5 little presses right on the side of our bones. There's deep lymphatic nodes, and we want to wake them up. Wonderful. Now we'll cross. 1, 2, and we're going that way. 3, 4, 5. Now we're going to go on the affected side and we're going to send fluid or kind of open up the track to this way. So you can go up and across, up and across, up and across, up and across. If it feels more comfortable to go down and across, that's okay too. But either way, we're stretching the skin. If you have a port, just be careful. Kind of stay a good inch up or down from there. Great. All right, so now that we've opened each quadrant, we're going to tell the body which way to go so that if any fluid kind of gets stuck here, we know that we can use the road. So we're going to go 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. We'll do this up to 10 times. Today I'm going to do 5. Now we're going to wake up the fluid from the armpit down to the groin on the affected side. We're going to do that first by standing up for this video just so you can see my position at the groin. We have many, like up to 16 to 20 healthy lymph nodes in our groin. And so this is a great way to help if there's some backflow in our affected area. What you can do is come right through here. Best to be skin on skin. Wonderful. Then you actually go right onto the skin. You're gonna go down, 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 down. Stretch and down, stretch and down. Once we've done that, we'll go to the side. And you wanna imagine, like I said, that there's a road that goes right to here. So I usually cuff just the lateral aspect of the breast. If it's tender, just stay pretty gentle. We're just pushing cross and down, cross and down. Now I'm gonna go 1, 2, 3. 1, 2, 3. So I'm telling my body that if any fluid gets kind of stuck into this area, the breast, there's an extra road that can go down to help suck up the fluid. Wonderful. So now that we've opened up the lymph nodes in our neck, the lymph node road on the top, and the lymph node road on the bottom, we can start to work on the quadrant. Okay, so I'm placing my hands right here. There's a nice little triangle between our collarbone, our neck, and the muscle in the back called our upper trapezius. So I'm just scooping in, scooping in. Again, if you have a port, just be careful. Okay. Now we're gonna take the top of our shoulder, we're just scooping. Stretch and scoop, stretch and scoop. And then you'll just start to work your way down. Depends on where the fluid is. If you're feeling some more here or here. If you don't feel any swelling down here, I usually will just do about 5 on each side, on each area, to kind of wake everything up. But I'm stretching and up, stretching and up. And this is really where your individual lymphedema therapist or exercise rehab therapist can really assist. Right here in the medial side, this inside, is often where we keep a fair bit of fluid. So I'm just gonna kind of go here with my fingertips now, and I'm just sending it up. Then working on the dorsum, also known as the forearm. What I like to do is I like to do our neck once again, 5 times. I go from the affected side to the unaffected side. And then I go straight down. And then always end with diaphragm out your nose, out through your mouth. Thanks for listening.